Well, hello and welcome to Navigating COVID-19 Now and Whether to Mask or Not. My name is Holly Foxworth. I'm a registered nurse and I am the marketing manager for content here at Axiom. And I thank you for joining us today. I'm joined by Dr. Scott Cherry. Dr. Cherry, thank you for joining us today. I appreciate it.
My pleasure. Thanks for having me.
Yeah, it almost kind of feels a little deja vu-ish to prior events here. But I will let you could you give us a brief introduction and just kind of tell us how you navigated us through this last time?
Are you talking about COVID in the
Yeah,
past?
yeah.
You
did.
know, COVID has obviously been super challenging for the world, and for us at Axiom, it's challenging because we were trying to provide guidance before really there was a lot known about COVID, and before kind of the CDC could make timely recommendations for the public. And so for a lot of our clients that are critical infrastructure, they needed to stay operating the whole time. And so, really approaching it as conservative, but as, with the strategic look at trying to keep our companies operating while being as safe as possible for COVID infections, so really difficult times.
It was a difficult time. You're exactly right. But we're so fortunate for you. And I know that there's so many organizations across the country that are fortunate for you as well, because you helped lead all of us through that and really provided such great guidance. And I'm just so appreciative. Well, give us a state of COVID. Where do we stand right now? The numbers look like they're heading up. And it feels like there's a little bit of hysteria that's building a little bit. So where do we stand right now?
Yeah, and I think the metric that's, putting people a little bit on guard is the hospitalization rates. The CDC is tracking hospitalizations kind of on a week-by-week basis. And what we've seen probably for the last 4 to 6 weeks in a row is probably a 10% increase on kind of that hospitalization number. And, so this is for the whole United States. So probably 4 to 6 weeks ago, we were seeing, 6,000 people hospitalized per week. But again, that's for the whole United States. So very small numbers compared to the peak of COVID over the last 3 years. But when we look at it week to week, when we see a consistent rise like this, in fact, I think this last week we saw over a 20% increase. So I think we're at around 12 to 14,000 hospitalizations now across the U.S. What's one of the biggest challenges right now is a lot of the organizations that were tracking infections, like the Johns Hopkins website and a few others like our World in Data, where we could kind of see the COVID in just the infections, almost all of them stopped tracking this in March of 2023. So kind of the 3-year anniversary. Another metric I was using was the test positive rate in some of the fixed facility drugstores. And so kind of a very similar pattern, but maybe even a little bit more abrupt, where a couple of months ago, the test positive rate, so for every 100 tests given at these facilities, what percentage are positive? Back in June, the test positive rate was around 20%. And as of a couple of weeks ago, it's kind of doubled up to about 44%. So that's alarming in some degrees, but it's also it's a surrogate for infections. But I would have to say a lot less tests are being provided now than they were in the past. So it tells us something. It doesn't tell us everything. Like if we were having good data about infections that used to be tracked. So I think the numbers are still very, very small, but from what we've been talking about now, is this kind of a trend that we should start paying attention to more and more? And I think we're starting to see, just anecdotally, like in your friends and family network or work network, more people are starting to say they tested positive. And I think there's some other things we'll talk about too. But yeah.
Mm-hmm. Absolutely. I think I pulled the numbers this morning, and just for comparison, I think they were showing that this last week we had 13,000 hospitalizations, but this time last year it was 41,000. So it's significantly lower, definitely significantly lower, but definitely on the rise there for sure. And Dr. Cherry, are there three variants that really seem to be causing the biggest problem, or what are your thoughts there? Is it the main three that we're looking at and that everybody's keeping an eye on? It seems to be.
Yes, so I think people started. They learned a lot about virology and biology the last 3.5 years now. And so with these COVID viruses, that with so much replication, there undoubtedly is mutations that lead to new variants. And what's really the big lineage right now that's driving the majority of infections is from Omicron, that lineage. And so when we talk about vaccines, that'll be important because we had the wild strain that was the original strain that the vaccine was. The first vaccine was originally kind of created from, and then Omicron was significantly different from the wild strain. So that's why we saw that huge outbreak that just really overwhelmed really the world, about 1.5 years ago, because it was significantly different. And so there are some variants of interest, or maybe even a variant that's not technically a variant of interest, but it's significantly different than the previous variants that are the majority of infections. So I kind of have to write them down to a degree because they're quite long. But the one that I think has, that's kind of under the radar but has significant spike protein mutations is the BA.2.86. And so that's kind of interesting because right now it actually doesn't have enough infections to be tracked under its own name. So it's lumped into the other similar lineages, but as it potentially makes more and more infections, it will become its own if that's the case,
Mm-hmm. Yeah. Well, and it looks like that one, I think they had said that it does look like there's an international transmission. They found it in 5 countries. Is that correct?
Wow.
Yeah.
There's a few in the States that I'm kind of tracking. And so, I appreciate the new, this is, quickly evolving. So it's not something that's like in the textbooks, right?
For sure. Absolutely. Well, I want to turn the conversation now to masking. It brings up a lot of debate. There's a lot of feelings that go along with that, but, it looks like so when you look at people that have implemented, masking policies, so we're looking at Lionsgate. So that was one of the Hollywood studios. We've got some of the Kaiser Permanente. We've got Rutgers University, and then also Morris University. I was looking at some of the school closures. We've had one that was in Texas, and now it looks like that we had 2 that are in Kentucky, where they've just had these extreme outbreaks with their students and their staff. And one of the things that sticks out to me as well is that it sounds like it's not just COVID, that there could be some strep and some other things that could be going on here as well. Is that your understanding?
Yeah, and I don't know if it was you, Holly, that coined the term triple epidemic or triple demic, but we did a webinar on that, I think last fall, or in the past at some point, but that speaks to COVID, flu, and then RSV, which even I have to admit, I thought was mostly a childhood disease, just from kind of my past medical experiences. But it's become more and more, I think, as a player in upper respiratory infections that are driving a lot of people to be out of work, to be sick at home, et cetera. So you in some ways you need kind of a comprehensive strategy to deal with all of those individually and as an organization.
hmm So whenever you look at this issue of whether or not to mask, who would you say that you would identify, or
Mhm.
what questions would you say that you should ask yourself to identify whether or not that you need to be wearing a mask, maybe in a public place?
Certainly. So when we look at severity of disease, primarily we do see the risk goes up dramatically as as you look at the age of people getting infected, and a lot of the guidance, I think, focuses on 65 and older. I've heard some docs talk about 70 and older, but essentially, I think right now most or almost all of the hospitalizations are in that 65 or 70 and older crowd. And so that does speak dramatically to the risk just based on age. You do think of just overall health status too with comorbidities. So, do you have other chronic medical conditions that may make you more susceptible? And so, you think of your own personal risk, maybe even your risk of in your household, like do you have elderly that you share time with or residence with or with work? So obviously occupational exposure too. So if you're a healthcare worker or if you're just a worker in close contact with other workers or with the public. And so, I think all those things have to be taken into consideration. But again, I think the biggest risk that has been demonstrated in studies and what's currently happening in hospitalizations are over 65. But also think about it as it's not like a clear cutoff, right? So at 64 means you're at no risk, and then 65 you're at extremely high risk, right? So there's this continuum of risk. So you know 64 versus 50 versus 40 versus 30. But it also depends on your personal risk tolerance. I know our chief legal officer talks about that. I mean, he's been talking about that for years before COVID for other reasons. But risk tolerance is kind of like, do you drive slowly? Do you drive quickly? All of these things. Do you wear your seatbelt? But yeah, really having a comprehensive approach. And I think really the best is to get personalized medical advice, talking to your medical provider, because that's how you really have the best advice. The CDC gives general guidance and guidelines, and we obviously provide general guidance, but really the best is personalized advice.
I agree completely. Good information. Let's talk about vaccines, because there was some new information that came out from the government today that said that they may have some new projections on when vaccines will be available. What's your thoughts there? What does September look like? It's mid-September look like where our target is there?
I think so. Yeah, I think so. Flu vaccination has been around, forever. And every year there's, we try to match, or, the public health experts try to match what's going on and predict the future kind of iteration of the flu variant. Also, RSV is something to consider. And then obviously COVID vaccination has been really kind of a big focus here in the US and in the world. And previous to what we call the bivalent COVID vaccine, the COVID vaccine was based on the original strain. So when Omicron hit, and it was, different enough to evade a lot of vaccine induced and acquired immunity through infection. That's why this bivalent, so essentially two different strains in this vaccine are now there to really help address both wild strain lineage and the newer Omicron lineage strains.
Okay. And what is it that we can do then? Just some standard precautions. What would you say if we take it back to basics and you say, how is it that I can protect myself? How is it that I can take care of myself in the best way that I possibly can to prevent exposure and getting infected? What types of things would you recommend?
I guess there's a couple of ways to look at it. So there's ways to really make your resilience as high as possible with your personal health status. So you want to really maximize your health, in the sense of, getting a physical, talking to your provider about what things you can do to just improve your general state of health. I think there's been studies that show, having actually vitamin supplementation, the different types of vitamins out there. Physical activity is obviously a marker of health. And I do think there's studies that talk about physically active people are actually do better as well with COVID. So you have kind of this just internal health thing, which you probably should do just to maximize your own life experience. But, again, so many things get in the way of that too, potentially. So, but I think it's worth reiterating now, right, that your health is a marker to help you withstand challenges, to your health as you get sick. But specifically for COVID too, then there's like protective measures. Obviously masking has been a big debate as well. Now we've been 3.5 years into COVID. Prior to that, I think the guidelines from the CDC were, estimated from other respiratory diseases, or just maybe based on, expert opinion, clinical judgment, things like that. But now that we've been down this road a while, there have been, many studies that have been performed, and then even like a large meta-analysis, which is a study of studies to kind of glean like what's the overall preponderance of the evidence. And so obviously there's different types of masks. There's kind of the surgical masks. Then there's what is called a mask sometime, but it's actually a respirator, a filtering respirator called an N95, or there's other variants like a KN95, that's actually really truly a respirator. And so right now, sadly, the data from these studies are kind of indeterminate about the value of surgical face masks. And then even looking at N95s to face masks, there's not a lot of strong evidence, but there's a lot of limitations to studies as well. But what I would say is, just going back on first principles, if you truly are trying to protect yourself, a certified respirator is going to be a much better approach to, if you are going to wear some type of personal protective equipment. That's going to be essentially more protective than a surgical mask, so depending on kind of your risk tolerance and just probably several factors, cost, if you're going out into public spaces, a host of things, then, those are things to consider. It also probably helps to talk with your healthcare provider about this too, because you do need to be, in some ways medically cleared to wear these respirators. When we do formal occupational health programs for other exposures that require N95, it does require medical clearance and then even medical fit testing. This wasn't necessarily applied with the COVID epidemic just because of the magnitude of what was going on, but show the actual protective rating of an N95 when you get a fit test.
Yeah, definitely. What would be some of the other things, like, do you suggest still continuing some of the hand washing, some of the physical distancing if necessary? What type of suggestions would you give?
So the studies that are looking at these protective effects or measures, hand washing was actually fairly effective, and it was more effective than wearing face masks. Mm-hmm. So, I think that's definitely something strongly to consider. If you are sick, then not to go out into public is really a big one. And then, deciding whether you go out into crowded areas, that's a tough one. I keep looking at kind of the trends that we're starting to track again to see, what's the major risk. But, essentially right now it's kind of watch and wait to a degree, you know.
Gotcha.
Mhm.
Dr. Sherry, we had a question that had came in as well that was asking, what are the industry suggestions for testing or retesting after illness for return to work? Excellent.
Right. Yeah. You know, and I think before we had a lot of strong guidelines from the CDC. You know, CDC is an advisory agency that doesn't necessarily enforce workplace guidance. That's really OSHA's job. But for a while there, you know, the CDC guidance was, I think, somewhat to a degree considered enforceable through OSHA. Right now, I'm not aware of any strong requirements that are enforceable. You know, so but if you're looking for kind of like best practice, you know, the last guidance that I saw was kind of 5 days from illness that you would be relatively considered not infectious any longer. But you know, that was still estimates from studies and things like that. But if you can, you know, get a negative test before returning to work, that would probably be the safest bet, you know.
It's a negative test before returning to work.
Yeah.
Okay. And then what about those that are symptomatic, those that are having fever and things like that? You shouldn't be coming to work with that. You should be waiting until that discontinues, correct?
Certainly. Yeah. Fever is like a really strong indicator, even if you're not formally diagnosed with COVID, but if you do have a fever and other symptoms, you know, that's really a strong symptom that is telling you you're infected of something. And, you know, you should kind of, you know, socially isolate.
Awesome. Dr. Sherry, thank you so much for sharing this with us. You know, going into the weekend, it's like there's so many things that are planned. And as you had mentioned, the news travels so fast and things are constantly developing. And so I appreciate you getting this information out to our audience. For all of those of you that may be listening or have additional questions, obviously we're here, we're available, we're resources. We can help you in any way that we possibly can. So you can reach out to us directly and we're happy to help you there. Thank you again. Have a great weekend. And thank you again, Dr. Cherry, for joining. And then Jason, thanks for that reminder as well, that we do have a webinar that's going to be coming up this next month. It's Faking It, Imposter Syndrome. And so we will send out some additional information and get you signed up for that if you haven't already. Thank you guys and have a great weekend.